All right, it's 8. Good evening, everyone. Thanks for tuning in to our presentation on stud dog management with Dr. Marty Greer and Breeders Cupboard. My name is Sarah Manzi on the Pro Plan breeder team. I'm a second generation dog breeder, and I'm going to be your host tonight and fielding questions to Dr. Greer and Miranda. We're aiming for about an hour and a half, including our questions. Next slide, please. Oh, one more slide. Dr. Greer, would you mind telling us about your background as a veterinarian and a breeder?
I'd be happy to. I've been a breeder for 37 years in Pembroke Welsh Corgis and 12 years with Danish Swedish farm dogs. I brought in one of the early farm dogs. The first dog to get a certificate of merit in the US is Olga. She's sleeping next to me on the couch right now, rather uncomfortably because she's sleeping on a cord for some reason. I've been a veterinarian for 44 years. We have four practices. About 30% of what we do in one of the practices is canine reproduction. So I've worked with breeders my entire career. Absolutely love my breeders. I've written two books with a third one that's almost ready to come to press.
Exciting. All right. Miranda, do you tell us a little bit more about yourself?
Yeah, I am a breeder in Alberta. I've been raising basset hounds for about 18 years. I started the Breeders Cupboard selling whelping kits out of my home, and the company has grown thanks to all of you. So we spend a lot of time speaking to breeders every day about your successes and your challenges, and I'm really excited to be here. I love speaking about stud dogs, so this is great.
Awesome. All right. So here's an overview of the 8 topics on stud dogs that we're going to be covering this evening, followed by a short message from me on Pro Plan, Miranda with a message from Breeders Cupboard, and then we will wrap it up with some Q&A, time permitting. Just a note that this presentation is intended for educational purposes. Please speak to your veterinarian about any concerns with your own dogs and puppies. Right. Slide. Okay, we're going to be keeping everyone on mute during the presentation, but please do put your questions in the Q&A box as we go, because I will be jumping in today to ask Dr. Greer your questions, but only questions that are directly related to the topic being discussed. We'll also end with a general Q&A after our sponsor messages, time permitting. Please take a moment to notice the difference between the Q&A box and the chat box. We'll be taking questions for our presenters from the Q&A box only, but feel free to use the chat box to connect with each other during the presentation. If we don't get to your question, I do apologize in advance. I will be skipping questions that would be better directed to your own veterinarian about specific health concerns. Plus, I'm also going to try and consolidate similar questions so we can get through more of them. We're going to get to as many as we can that we have time for tonight. With that, Dr. Greer will kick us off.
All right. So thanks everybody for being here. I know it's really cold where you are. It's really cold where I am. So I'm in Wisconsin, so I'm not exactly in the balmy part of the country. We went to the dog shows last weekend and it was 15 below, not counting the wind chill Fahrenheit, is really cold. It was about that cold in the building, I think. So we're going to talk tonight about a number of different things regarding stud dogs. We're going to talk about the physical exam, brucella testing. Brucellosis testing, I think, is a really important aspect of what we do with our dogs for breeding. We recommend from the Society for Theriogenology, which is the group of veterinarians that do reproduction, that all dogs are brucella tested and found to be negative prior to the time that they're bred. Currently in the US, we don't have any USDA approved in-house veterinary brucella test kits. Those are still on the market as non-USDA test kits. They're not approved by the USDA. They're not overseen by any kind of organization. So I have concerns about the ones that are being used in office or in breeding kennels. They're fine for an initial screening test, but if you're really looking for the absolutely accurate answer, those blood tests should be sent out to a reference lab. Tick-borne diseases are also really important where we are and probably in places that you are as well. Lyme disease, anaplasmosis, and Ehrlichia certainly have a relationship associated with poor fertility and sickness during pregnancy. So we don't like to breed any of our bitches prior to the time that they are tick-borne disease tested and found to be negative. We recommend that you do those tests along with the brucella test about a month before you expect the bitch to come into season, so that you still have time to do a C6 if she's Lyme positive and get her on a course of 3 to 4 weeks of doxycycline if you do have a tick-borne disease. Every day in our practice, every single day in our practices, I have 4 locations. We diagnose at least one dog with Lyme disease, anaplasmosis, or Ehrlichia. And I think that's really important because that helps us to know that if that is the case, that you're not adequately managing your tick-borne diseases. I have clients that come in with Newfoundlands and they say, well, I've never found a tick on my dog. Well, she's 160 pounds and she's black. I bet you never have seen a tick on her. But it doesn't mean she hasn't had one. You don't get positive for Lyme disease, anaplasmosis, or Ehrlichia unless you've had a tick. The other thing is there was one article published back in the 90s that showed that Lyme disease could be spread venereally through semen from an infected male dog to a bitch. So I think it's important that you keep that in mind. We see poor fertility on the male side, we see poor fertility on the female side, and we see sick bitches during pregnancy. If they've been Lyme positive and then they're pregnant, the immunosuppressive effect of pregnancy can significantly alter the bitch's ability to manage and keep that disease in check. So keep that in mind. Semen collection, we're going to talk a lot about libido, and the semen analysis and the eye sperm we're going to talk about. So those are the things that are coming up. Physical examination, I think, is absolutely essential that you're working with a veterinarian, that you're taking the dog, female or male, in prior to the time that you do the breeding, that they do a good comprehensive physical examination, make sure that overall the dog seems to be in good health. Obviously, genotype and phenotype testing are important, and we're not going to have time to go into all of that tonight. That could be 2 hours of lecture all by itself. Genotype meaning DNA testing, phenotype meaning OFA type of testing, which are observation tests. Hips, elbows, spines, tracheas, Boas testing, thyroid, eye, cardiac, bear testing. All of those are the phenotype tests that are based on observation tests, not on DNA tests. We don't have DNA for everything at this point. Orthopedic examination, again, is really important. Obviously, you can do OFA hips and elbows. You can do OFA shoulders, but we don't do knees. We don't do x-rays for patellas, but we do assessment for patellas. And I think it's also important that we talk a little bit here about cruciate disease. Cruciate rupture probably has a genetic basis. I know a lot of people will come in and I'll be holding their dog up to collect his semen because he just had his knee cut. And that makes me really unhappy to see that those dogs are being used in the gene pool. There is now, and this is new, this is really new, there's a DNA test for Labradors, at this point only Labradors, for cruciate disease. It was developed at the University of Wisconsin. It's a DNA test. It's the first complex DNA test that's come to market, meaning that it accounts for multiple genes that all go into the contribution of cruciate ruptures. And that test runs about $250 to your cost, plus the cost of the sample collection and submission. It's a cheek swab. So again, it's really important that you know that this test is out there. Currently, it's labs. They're looking at it in Rottweilers and Newfoundlands as well, but currently it's only Labradors. And then, of course, part of the physical exam for a male dog that we're going to be using for breeding will be to examine his genitals. That's his scrotum, his penis, his testicles, his prostate. So all the parts of his reproductive tract should be part of the comprehensive physical exam. And I go round and around with clients frequently because they'll say, well, I just had my dog at the vet, female or male, and my vet said that he is fine or she's fine. Well, if they didn't look at the penis, if they didn't, palpate the testicles, if they didn't palpate the prostate, he probably didn't get the kind of comprehensive exam that a reproductive veterinarian would be doing. So those are things to keep in mind and to really take into account. There is a Society for Theriogenology and a College of Theriogenology that are the veterinarians that do work with animals that are reproductively active. So that may be horses, cows, sheep, goats, whatever species, including dogs and cats. And those are the veterinarians that really focus on this. The Society for Theriogenology are the veterinarians like me that are general practitioners that have an interest in reproduction. The specialists that are board certified are in the American College of Theriogenology. So they're two related organizations, but not interchangeable with each other. So if you're looking at getting a reproductive workup on a dog, male or female, that's having fertility issues, you want to be looking for somebody that's a member of the Society for Theriogenology or in the American College of Theriogenology, ACT. So those are things to keep in mind.
We've got
Okay,
a question before we get on to the semen
great.
analysis part. Do you need to do a brucellosis test on a dog that's never been bred before breeding?
The answer is you should. Brucella can be passed through any body fluid, urine, obviously semen and vaginal secretions, blood. Puppies can be born with brucellosis if their mother had brucella. So you cannot assume just because it's never been used in a breeding program that the dog is automatically negative.
Okay. And then we have another of, oh, it's a tick disease that I'm definitely gonna
Okay.
butcher. What do you recommend testing wise once a dog has been diagnosed and treated for Ehrlichia before being
Ehrlichia.
used at stud? Yeah, before being used at stud again.
Yeah, Ehrlichia and Anaplasma, they can stay positive for very long periods of time. And the question is, if they're positive, should you automatically go ahead and treat them? And there's a lot of debate among veterinarians. I'm of the school of thought that if you have a positive test for anaplasmosis or Ehrlichia, that you go ahead and do the treatment of 3 weeks of doxycycline. For Lyme disease, IDEXX runs a test called a C6, which is a confirmatory test. If they're under 30, they probably have an old or an inactive infection from Lyme disease, maybe from a year or two ago. If it's above 30, then you probably have an active infection. We see dogs that die of Lyme nephritis, which is a kidney problem that develops from Lyme disease. We can see that in males and females. I've had females go into Lyme nephritis and die during pregnancies. I've seen dogs that aren't pregnant go into Lyme nephritis. We've had them come back as high as 800. So those are significant tests. So yes, I would absolutely be testing those dogs. You don't have, ticks cross the border from the United States into Canada. We have clients that live in gated communities and they're like, well, I couldn't have ticks because I live in a gated community. Well, newsflash, that the rabbits and the mice and the other species, they don't care that you're in a gated community. They come in anyway. So be sure that you're doing a good job with your tick control products.
All right.
Any
And
other
then
questions, Sarah?
just one more that kind of relates in. Somebody had spoken to you a few years about a cleft palate puppy. She
Yes.
said you were fantastic. Um, the breeding wasn't repeated, but the stud dog useless to her program now?
No, there's a genetic component to it. There's an environmental component. It can be cleft palates and other midline defects can be caused by excessive amounts of vitamin A. They certainly have a genetic component in some cases, but not exclusively. So I wouldn't throw a stud dog out of the gene pool, but I would be very careful who I bred to, and I would be using adequate amounts of folic acid on the bitch 6 weeks prior to the time she comes into season. So I would absolutely consider using him again with those precautions.
Perfect. All right. We'll let you get into this part. I know there's already
Okay.
questions on this one.
Good. So the semen analysis, I think, consists of really 6 parts. One is volume. So how much is the volume of the collection? Two is color. Obviously, you can assess that with your own vision. So the color should be a cloudy white. If it's yellow, that's urine. If it's yellow and cloudy, it's probably pus. If it's red, it's probably blood. So those are really important components to make note of during the collection. Motility is how the sperm are swimming. So it's not mobility, it's motility. Are they swimming across the slide in a progressively forward motion? Number 4 is morphology. How does the sperm cell look under the microscope? Number 5 is the sperm count, the total number of sperm in the ejaculate. And number 6 is longevity. How long do the sperm live when they are collected, put into extender, and then refrigerated and reevaluated within 24, 48, and 72 hours? The kind of experience that those sperm would have if you were to ship fresh chilled semen. So those are the parameters that most veterinarians use. So we're going to talk a little bit about how you get all those numbers. The volume is the first thing that you measure, and that's going to be how many cc's you get. Now, I have clients that look under their dog as we're collecting them and they're like, oh, he didn't do very well. There's only a little bit in the tube. Well, we don't need gobs and gobs of ejaculate. We need the really good part, which is the second part of the ejaculate. The ejaculate comes in 3 parts: pre-ejaculate, ejaculate, and post-ejaculate. Pre and post are prostatic fluid. That's just extra fluid that doesn't really contain any sperm. The actual sperm-rich fraction is the second part of the ejaculate. That's the part we really want. And you can have as little as 1 cc and still have a billion sperm in that amount. So don't look under your dog and be automatically critical of him because he didn't produce a gallon of prostatic fluid. German Shepherds will collect 30 cc's, but that doesn't mean that their sperm is any better. It just means they had a lot of prostatic fluid. So when we're trying to calculate our sperm count, this is semen math. Now there's girl math, which is the stuff I do when I go shopping. And I come home and say, well, look how much money I saved. And my husband says, oh, that's girl math. That doesn't count. This is sperm math. So this is a little bit different. So we have volume. So how many cc's did the stud dog collect? Number 2 question is how many sperm were in each cc? And we'll show you how to do a sperm count. Number 3 is the motility. How many of those sperm, what percentage of the sperm is progressively motile, meaning how many of them are swimming in the direction we want them to be swimming, which is forward with their head forward. If they're swimming around in a circle, they might be cold. If they're swimming backwards, those sperm are not going to be eligible to fertilize an egg. So we mathematically throw those out. And then morphology is how does the sperm shape look under the microscope? So you want to take the volume, which is how many cc's, times the number of sperm per cc. That'll give you the total sperm count. Multiply that then by the motility. So if it's 60% motile, that means 40% aren't swimming, so those don't count. And then if 40% of those aren't normal, then those don't count either. So it's the volume times the sperm count times the motility times the morphology to give you the total number of progressively motile normal sperm in the ejaculate. Now we can get as few as 0 sperm in a nice normal collection, or we can get as many as enough to collect and freeze 20 breeding units. So I think it's highly variable one dog to the next, depending on what breed you have and what your expectations are. The average number of sperm for a dog is going to be 10 times their body weight. So we'll talk about that in the next slide, but we need at least 100 million sperm and possibly more like 250 million sperm to get an effective outcome, meaning something that produces a pregnancy. If you have a little tiny Pomeranian, they may only have 50 million sperm, but that's enough for a Pomeranian. If you have an Irish Wolfhound, you may have a billion sperm, and that's more than you need for one successful breeding, but that kind of gives you an idea of how wide those numbers can swing. The average dog has 10 times their body weight in sperm. So a 50-pound dog or a 60-pound dog, like a golden retriever, is going to have 500 million sperm, or he should, or 500 million sperm. The exception to that is the bulldog, because they always have enough sperm for a 100-pound dog. They're really 100-pound dogs that are just pressed into a little 50-pound or 60-pound body. They're really not 50-pound dogs. So the average is going to be at least 100 million. So if you're buying a breeding unit that's frozen, you want at least 100 million. If you're shipping fresh chilled semen, you want at least 100 million, preferably more than that. If you're under 100 million and you have an average sized dog or a large dog, that's not going to be enough. If you have a Pomeranian, a Pekingese, some of these little tiny dogs, 50 to 100 million is enough. So volume times sperm per cc times motility times morphology gives you the total number of viable progressively normal sperm in the ejaculate. So that's semen math. The next part about semen math is what is a breeding unit? And people throw around the word straws like they somehow know that that's automatically a breeding unit, and it's not. A breeding unit is how many sperm does it take to get a bitch pregnant. In straws, we typically say 100 million, and that's oftentimes 4 straws, maybe more. In pellets, it may be 6 pellets, it may be 100 pellets, depending on the concentration of the sperm. So there's 2 ways to freeze semen. One is in straws, and this picture on the top is what a straw looks like. It contains 0.5 cc's, a half a cc. A half a cc or a half a milliliter. Milliliters and cc's are the same thing. Pellets actually look just like Dippin' Dots ice cream. They're frozen on dry ice, and they're in little tiny pellets like Dippin' Dots. I hope you all know what I'm talking about. You have Dippin' Dots, right? Okay, so you know what I'm talking about for ice cream. So you can have a variable number of pellets or a variable number of straws to give you a breeding unit. So it depends on your breed. It depends on the semen quality. So before you make a purchase from another breeder, and you say, I would like to breed my female with your frozen semen, you want to ask for the veterinary clinic or the freezing center's report on how many sperm are considered to be a breeding unit. It should be 100 to 250 million sperm to be a breeding unit. If they're selling you something that has a poor quality thaw, if they're selling you something that thaws at 20%, you probably are going to need more straws or more pellets. So you want to have that information before you make that final purchase to be sure that when you buy a breeding unit, you have a reasonable chance of getting a bitch pregnant. Most of the time when people sell frozen semen, there are no guarantees on a pregnancy, but you don't want to start off with something like 20 million sperm and have them say, oh yeah, she'll get pregnant. She won't with 20 million. So you want 100 million to 250 million to get a good breeding. So those are really important things about semen math and semen nomenclature. Um, so you understand kind of the verbiage, the language, and the math that goes with this. So Miranda, you want to talk about how we get sperm counts?
Well, we sell a couple of things at the breeder's cupboard that are pretty handy for doing that outside of your veterinary clinic. The first one is the eye sperm. They You're going to speak about that a little bit more, Dr. Greer, so I'm going to leave the science of it behind, but you do need an iPad mini 6, just so you guys are, if you're looking on the website for them, they connect to an iPad. And it works for more than just dogs. It goes across the horses. A lot of equine people use them as well. And it's a pretty awesome little device. We also sell a couple microscopes. I've used both personally. The first one is our bigger one. It's got a big screen on it, and it's got 3 different magnifications. You can hook it up to your computer to record it, so that's kind of neat. And it comes in a little carrying case. I've used mine quite a bit. The other one I started the first time I ever looked at the semen was with this little microflip microscope. They're really affordable, and they hook up to your phone. And they're not great quality. You're not getting a semen analysis with this, but you're going to know if you have sperm, if the numbers look dense, and if they're moving, which is sometimes best if you're doing a quick AI and you aren't going to the vet and you just want to make sure you got a good sample. I love my little pocket microscope. I've sent a lot of texts to my vet. Is this good? Can I use this? So they're handy, and I think they're like $50. So definitely worth investing in if you're doing lots of AIs at home. We also sell the canine collection funnel system. I personally have not used it, but I have quite a few breeders that have asked me to bring them in, and they find them very helpful. There's 3 different funnels that hook up to little test tubes, and it's to help you divide the 3 different fractions of semen. So I personally don't know how you can go from 1, 2 and not miss it. That kind of makes me a little nervous, but the people that use them swear by them. And then you've just got your semen divided up into, and you can throw obviously your 3rd fraction away. And then Dr. Greer did touch on the canine brucellosis test, and they are not approved. I know that they use them in the vet clinics a lot in Canada. However, I was just reading an article about them a couple of weeks ago, and I've heard that there's a lot of false positives. So we actually might be a little more conservative on selling those if they're not reliable. But we do sell them currently, and if you need to do a quick test at home just for your own peace of mind, that might be a good option for you guys.
Right. So
Right.
go ahead.
I just didn't know if you want to jump into questions.
Yeah, if you've got some, we can certainly do
Yeah,
that.
we've got quite a few. Miranda, the first one is for you. Are there microscopes phase contrast?
Sorry, try that again.
Are the microscopes phase contrast?
Probably
I
not.
don't know the answer. I don't think so.
Probably not. Those are
Okay.
I
pretty
don't know.
expensive microscopes. Those are going to be 7,000 plus.
Yeah,
Okay.
I know. Oh, I know what you're talking about. Yeah, no, they are not.
Okay. The next one is, do giant breed dogs require larger numbers for breeding units?
Yes. Typically, the larger dogs were going to be 250 million in a breeding unit. A small breed dog is going to be 50 to 100. So yes, there are definitely variables simply because that's the way nature works.
Okay. How often can studs be used and still be potent?
That depends on the age of the dog. If you have a young dog, 2 to 5 years old, he may be able to use a couple of times a week and still be fine. Once you get to the older dogs that start to have poor semen quality or they don't regenerate quite as quickly, you may be a week or two between collections. So one of the concerns I have when people come in for an evaluation is they're like, I did a clean out last night. Great. You took all the semen that you had and you threw it down the drain. Thank you very much. So if you do want to collect the dog and do a clean out, which dogs don't actually need, do it a week or two before your appointment, before the time you need him for a stud service. Don't do it the night before because you may have taken everything he had, especially if he's an older dog. And then we've got nothing left when we go to collect. That's the other reason to do your timing with progesterones is I'll have people that'll do natural breedings day after day after day after day. And by the time she finally gets to the fertile part of her period, he's shooting blanks. So give the old guys a break and just let them have their time to regenerate.
Right. The next one is if a male only has 30% normal motility, but with that 30% has enough 200,000 in a breeding, would you still use that semen or would the ones with kink tails, immature, etc., be in the way for the good sperm?
No, they don't get in the way, but you have to mathematically calculate that you need to have at least 100 million normal sperm, 100 million to 250 normal sperm. So you don't, they aren't interfering. They're just not mathematically going to be included. It's not like you can go in and pick them out under the microscope and put on the good ones in. They all go in. They just don't do a very good job of fertilizing eggs.
If only you could pick the bad ones out.
Do that with
When in,
ICSI, but ICSI's not a thing in dogs right now.
when inseminating only the second fraction, must it be extended to approximately 8 cc's, or is the 2 cc semen-rich fraction enough to be inseminated without being extended?
2 cc's should be enough, but we typically add extender to every dog that we handle simply because it gives the sperm additional energy. There's energy rich product in there like glucose. It has antibiotics in it. It has some other things that help to just increase the volume so you have a better chance if you're doing a vaginal AI. Now, if you're doing a TCI or surgical, you want the smallest volume possible. If you're doing a vaginal AI, that larger volume gives you that extra boost to get the semen up into the uterus.
All right. And then the last one for now is, can you speak to urine in the collection?
Yes, I can. It's bad. So we don't want our dogs to urinate on the way into the clinic when we do the collection. If you're going to have them go potty, urinate them at home and then do your drive in. Don't let them urinate between the door of your car and the door of the clinic. Semen with urine in it, the semen will die because of the urine, so you don't want to have any of that. We like to collect our stud dogs with a lightly full bladder and without urine in the ejaculate. If there is urine in the ejaculate and you recognize that as such as it's coming into the tube, because these clear tubes or the clear sleeves that we collect semen into allows you to see it, immediately add extender, spin it down, get rid of the urine, add more extender, and then you may be able to preserve enough viable sperm to get a good collection.
Perfect. There's lots of other great questions. I see that, but we're going to get to some of those later as they pertain to some of the
Good.
topics later.
Good. Good. So the iSperm is this really nifty little, like Miranda said, an iPad based unit. Basically, what you do is you take a drop of semen, you put it on the lens of the iPad device that comes with it. Now, I was at the show in South Dakota 2 years ago, and this young lady who is 8 years old saw us do the semen analysis with the iSperm, and she jumped out of her chair. You can see we're in an auditorium. She jumped out of her chair and she said, I want to try it. She had seen us do this one time. She's 8. Her mother is in the background. You can see her kind of moving back and forth, taking video of her. And we allowed her to take the sperm that I had collected on my stud dog the day before because he stayed home. I took the sperm with me, put it on the lens of the iPad, put the device together with the um, device that goes onto the lens. And basically, you take this device and you screw it into the camera part of the iPad. And then there's a program on the iPad that looks at the sperm and it does a sperm count and motility analysis for you. So she spins it on, she turns on the iPad, and she starts the program. And in 90 seconds, this 8-year-old child was able to do a semen analysis. So I'm going to tell you that if an 8-year-old can do it, I'm going to say most of you can do it, and most of your veterinary clinics can do it. So if you're going to a vet clinic that doesn't do sperm counts, you're really going to need to get a sperm count to get a good assessment of what your stud dog is doing. These run around $4,000 US. So they're not free, but they're not $40,000 like the entire big CASA systems, the computer assisted semen analysis systems are. So if your vet doesn't have the ability to do a sperm count, you can talk to them about either purchasing one of these, or what I've suggested in some communities is that a group of breeders get together and say, okay, we have this young vet, they're trying to get started, we want to support them. What can we do to get them working with us as breeders? You put together a pot of money and you go to them and say, we'd like to buy you an iSperm. Would you be willing to do semen analysis if you can do that? I was in Hawaii and they're in a very isolated area. Everything has to fly in and out of the islands. It's very complicated to get in and out. It's not like you can just drive there. So in communities like that, if you live in remote parts of Canada, you live in remote parts of the rest of the country, there might be times that a group of breeders getting together and saying, we're going to support a veterinarian that wants to get started in repro. This may be an appropriate spot for you to do this if you feel like you aren't going to use the iSperm enough to use it yourself, or you buy one and then you let the vet clinic keep it until you need to use it yourself. So there's a couple of different ways to do it, but seriously, that is not a lot of money compared to the $40,000 that it costs to get the big systems. You have any comments on that, Miranda?
Yeah, I was just thinking when you said pooling together as a group of my friends and I just purchased an incubator together, and we're sharing it with all of our litters, and that's a great idea for something like an iSperm as well. Um, I think for us, they're about $3,500 Canadian, plus the iPad. So you have to factor in the iPad as well. But I love the iSperm. I've had an opportunity to use one, and I found it really helpful.
Yeah. Yeah. I mean, they're really slick and they do a nice job.
Yeah.
So a good set of
cool technology.
Yep, great equipment. Okay. Stud dogs. Stud dogs that are having fertility issues oftentimes need to see a veterinarian and get a complete workup done. And Miranda has this lab in Canada. I don't use this lab. We use the lab at Cornell that does something very similar, but do you want to speak to this?
Yeah, one of my reproduction clinics does this test for my stud dogs. It's pretty affordable. I think we figured it's about $250 plus for just the test, and then whatever collection fees and stuff. You do collect blood and semen, and then they send it off. I think if you call me and you have a stud dog that's not producing good semen, this is the first thing I tell you to do: is go to your vet, ask them to run this test, because I can recommend all the supplements in the world. If there's an underlying problem, it's not going to help you. So I thought I would put the information out there. You guys can keep that. And a lot of veterinarians, if they're not specializing in reproduction, they don't know that this test is available. So it's something you can ask them. And they also run a loss of pregnancy profile for your bitch as well, the same lab.
Yeah, these are really useful tests if you're having some struggles with fertility. So it's a really good diagnostic tool. Okay, blood in the ejaculate. This is one of the most common things that we see, that we have clients that come in with a concern with. We're going to talk about the penis as a source of blood, bladder stones, and other areas of the bladder that are a source of blood, and then the prostate. The prostate is a pretty common source of blood in the ejaculate. The problem is most of the dogs that have blood in the ejaculate have benign prostatic hypertrophy, BPH, or hyperplasia, and not an infection and not prostate cancer. Prostate cancer, counterintuitively, not what most people think, is more common in neutered dogs than intact dogs. So most of the time, people think that prostate cancer is a disorder of the intact dog, and it's not. But BPH, benign prostatic hypertrophy or hyperplasia, is very common in dogs over the age of 5, especially if they're around females in heat, and very common in Bernese Mountain Dogs and Greater Swiss Mountain Dogs as young as 3 years of age. So I think it's really important that if you are seeing blood in the urine or blood in the ejaculate, that you go in, get a veterinary assessment, figure out what's going on. The most effective way to really diagnose BPH in the dog is going to be with ultrasound. X-ray doesn't tell us as much about the infrastructure of the prostate as an ultrasound does. But we can certainly see other sources of blood. The penis can have trauma to it during a breeding or an attempted breeding that can cause them to bleed. We can see urethral prolapse in male dogs, which is most common in the brachycephalics, like the bulldogs. And in the urethral prolapse, a little tiny bit of the lining of the urethra of the urinary tract protrudes out, and they can bleed from that. And it can be a dramatic amount of blood, very significant amount of blood. And that's something that is unrelated to the dog being older. It's almost always in dogs under a year of age, and it's often misdiagnosed by veterinarians who are like, oh, it must be his prostate. When you're a year old, your prostate is not the problem. Of course, the bladder can be a frequent cause of problems, so don't overlook the possibility of bladder infections and bladder stones. But most of the time, bladder infections happen in females, not in males. So if you're seeing problems with blood in the ejaculate or blood independent of the ejaculate, you want to work with a veterinarian to get the diagnostics done. All right. If we have a dog with benign prostatic hypertrophy or BPH, there are three treatment options. One is to neuter him. Clearly, once he's neutered, he's not going to be your stud dog anymore. So we try really hard not to neuter these guys if we can avoid it. Number two is we can put them on finasteride, which is a human drug. It's very commonly used on humans, on men over the age of 50, because many men in that age category do have benign prostatic hypertrophy or hyperplasia. So it's very effective. It's an oral medication. It can be given on a daily basis. There's only one size dose, and that's a 5 milligram dose. And pregnant women should not handle these tablets because that's the thing that they say on the commercial, that pregnant women may have a specific kind of birth defect. So I've talked to a number of groups, and I've said to people, don't handle the tablets if you're pregnant. Well, my 14-year-old granddaughter helps me with the dogs. Well, I hate to break this to you, but 14-year-olds can be pregnant. So do not let anybody that might potentially be pregnant handle these tablets. The third choice is deslorelin. Now, it's not a drug that we can use in the United States. It does cause transient infertility, but it does shrink the prostate. I want to just point out that this advertisement up here, there's more than one way to crack a nut. That is the deslorelin implant, and that is the advertisement that they had up at the Crufts dog show last year for this drug pellet that's inserted similar to that of a microchip. And basically, it shrinks the prostate so that you don't have to be concerned about BPH. It does not allow the dogs to stay fertile, but it's temporary. So you can treat with that if it's allowed in the country that you live in. But finasteride is going to be the drug of choice for most of our dogs with BPH. All right.
We've got a
So,
question on the finasteride.
yes.
Um, do you can you discuss the benefits of administering it versus the side effects when prescribed to a stud dog whose collections are satisfactory for the dog's age breed?
So, over the course of time, if he does have BPH, his semen collections will start to deteriorate. So, if you have a dog with blood in the ejaculate, even if it's intermittent, you're going to want to put him on finasteride and keep him on that long term. A lot of people will put the dogs on antibiotics because the veterinarian said, well, I don't know what it is. Here's an antibiotic. The blood goes away because the bitch that he was living with went out of season, and then his prostate shrinks back down, but it's going to flare up again as soon as she comes back into heat, or as soon as you go to a dog show, or you share a hotel room with somebody that's got a bitch in heat. One night in a hotel room with a bitch in heat is all it takes to kick these guys back into BPH. So finasteride should be used on a long-term basis. If it's a little dog, you may do it a couple times a week. If it's a large dog, 5 milligrams once a day is appropriate. And it is not expensive medication. It runs about $20 a month in the US. So it is not expensive medication to keep the dog on if he's an active stud dog that's important to your breeding program. If he's older and you're not going to ever breed him again and you've got plenty of semen frozen on him, fine, go ahead and neuter him. But finasteride will allow them to stay fertile and actively being bred. It will sometimes decrease the volume of the ejaculate, but you can take them off for a day or two, or you can add extender and compensate for the smaller ejaculate volume.
Do you recommend taking them off them before breeding? And if so, how long?
I don't, because I don't want them to have a flare up when I'm collecting them. I just add extender if I need to. And we have many, many dogs in our practice that are on finasteride.
Okay, and one more on BPH. Can silodosin also be used for BPH?
That doesn't really, to my knowledge, work on BPH. I use finasteride.
Okay, perfect. Thanks.
All right, prostate. We've talked about the prostate as a reproductive organ that's part of the reproductive tract. We'll talk about the penis, the prepuce, and the testicles. The penis is an important part that is part of the physical exam. This is a little dog that came to our practice to be neutered, and his owner said, "Gosh, he licks at his penis all the time." Well, we anesthetized him to neuter him, and I thought we should just take a look at his penis and see what's going on. Well, what you can see a little bit in this picture is that he has a frenulum, which is this little band of tissue right underneath the penis that allows his penis, when it's extended, to protrude downward. And the more erect the penis becomes, the more downward it protrudes. So if this were a breeding dog, and he wasn't, you would want to snip that little band of tissue, have your vet do it, snip this band of tissue, and then he will have a normal ability to extend his penis and be able to breed a bitch. So that's an important thing that your veterinarian should take a look at if they are doing a reproductive exam. We can also see tumors on the penis. Most commonly, they are venereal tumors, and they're most common in the Caribbean countries. So we don't see a lot of them. I've never diagnosed one in Wisconsin, but they are certainly in the literature. And other kinds of tumors can develop that are not venereal, viral tumors, but those do exist. So if your dog is having any problems with his penis, you should take a look at it. The other things that can happen are paraphimosis and phimosis, which is when the opening to the prepuce is not large enough. This top picture is a dog that was a young dog, and his penis became erect and then got stuck. So we can see these happen where the skin isn't adequately large to allow the penis to go back in. And this is a veterinary emergency. You want to get lubrication on here. Sometimes Karo syrup, the sugar in that, can help shrink the penis back down and get it back into the prepuce, the sheath. If it doesn't happen, then you may have to go into the veterinary clinic and have a surgery to open up the skin enough that the penis will go back in. Most of the time, you can get them back in without surgery, but oftentimes it does require veterinary involvement. And then smegma is this pasty, yellow, icky stuff. This dog in particular collected a lot of smegma on his penis. So on an annual basis, more often than that, preferably we would exteriorize his penis and take a look and clean things up. We don't want this kind of smegma to be part of the reproductive tract, because we don't want, when he's breeding a bitch, for all that material to end up in her vagina. So we don't wash penises on dogs the way they do on horses before they're bred, but we should be examining the penis and make sure that they don't have anything unusual going on. Oh, the other thing we can see on penises is we can see sometimes little vesicles that can be herpes virus. So if you see vesicles, little bubbles or blisters on the penis, that might be herpes. That would be a risk factor to the bitch that she might pick up herpes, and that may affect her pregnancy. Testicles, a very important part of the reproductive organs. We can see atrophy in the testicles as the male dog ages. They can shrink down. That's just senile atrophy. That's not unusual. We can see trauma to the testicles from bite wounds, from temperature extremes, too hot, too cold. We can see infections in the testicles if there's a penetrating wound. We can see testicular torsions, which is what this image is. This dog had a testicle that twisted on the cord, and because of it, it became engorged and needed to be removed. This was not a breeding dog, so we removed both testicles, but the top testicle is the one with the torsion, and the lower testicle is the one that was supposed to be normal. But since he wasn't a breeding dog, we just neutered him. And then tumors in the testicle are very, very common. They're most common in dogs over the age of 8, but there are 3 different kinds of testicular tumors. We can see Leydig cell tumors, Sertoli cell tumors, and seminomas. All of them lead to a lower fertility in the dog. I neutered a dog on Monday that had 2 testicular tumors in the same testicle. There are different shapes and sizes of them. By sending the testicle in for histology or biopsy, we can determine what it is. Some will produce estrogen, which will feminize the male dog and make him attractive to male dogs, even though he's a male dog with testicles. If he's producing estrogen in his testicular tumor, he might become interesting or sexy to a male dog. So that can be a little bit confusing. And if you have a valuable stud dog that has a penetrating wound, an infection, a torsion, a tumor in one testicle, and you can look at ultrasound to make sure it's only one testicle, you can remove just the abnormal testicle and leave the other testicle. Even if his sperm counts are not good, you can remove the other testicle, the abnormal testicle, and typically within 90 days, they are producing almost a normal sperm count by getting rid of the testicle that was the offending testicle that was setting up inflammation in the scrotum. You get rid of the bad testicle, the other testicle will step up to the plate and it'll produce almost as much sperm as the dog did with both testicles. So your veterinarian can remove just one if that's what you want them to do. I had one veterinarian say, "Well, I don't know if I can do that." I'm like, "Control yourself, buddy. Like just take out the abnormal one and then stop. Then just sew up the dog. Control yourself. You don't have to get carried away here." All right. What do we do if we have poor semen quality because of all these changes? Miranda.
Yeah, so at the Breeders' Cupboard, we have a few supplements that I recommend. We have Breeders' Edge in between for him. That's a daily multivitamin that you should be, well, could be giving your stud dog in between breeding seasons. You can get it in a great big tub, 360 count. So it's easy to give. It's like a chew, and I recommend it. Kind of fills all the nutritional gaps. We also have OxyStud. I recommend that any of these supplements, if you're using them for breeding collection purposes, you should at least start them 60 days prior to breeding or collecting to ship. So the OxyStud has a lot of vitamins and minerals. However, it also has some herbs that support reproduction and prostate health. If you really have a problem, if your male is not producing well, I highly recommend Problem Male. I've had it used on my own boys, and it's worked amazing. I recommend it to all of my customers that call that have a low semen count or sperm count. I don't know if you can give the two together, but I usually recommend in between for him along with Problem Male. I don't know, Dr. Greer, how you feel about OxyStud with Problem Male at the same time.
I think you probably don't need both at the same time, but
Okay.
they certainly are effective products. The other thing I am going to throw out there is there were some concerns about the formulation, and those formulations have been changed. So there was cottonseed oil in some of these products, but they have now been replaced with pumpkin protein. So if anybody had concerns about the products, we can eliminate those concerns off the list. It's completely reformulated.
Yeah. And like I said, the Problem Male, it's strictly there's no multivitamin, it's strictly herbal, and it does make a big difference. If supplements are going to help, this one will help. And then I also sell Canny Plus AI, so it's an semen extender meant for AI. It does have a probiotic or antibiotic in it, and it also has, like Dr. Greer was saying earlier, some energy for the sperm. So especially when you're dealing with low counts and you want to add some extender, there's this product, and then we'll talk about the other products that are designed for shipping later on.
We have a question on that one, Miranda. What's the shelf life once it's opened?
So you get it's a 20 ml bottle, you keep it in the fridge, and it usually has about a year to 2 years, depending on when we get it to you. And it's good. So as long as you keep it refrigerated, it's good as long as it's kept at a stable temperature until the expiry date.
Perfect.
And if you have a question about it, you can always put sperm in it, take it back out of the fridge in a day, warm it back up and look at it. And if the semen's still swimming, the product's still good.
Good tip. So we're talking about managing low libido. We also have a product called Get Him Going. I have never had to use this, but the customers that I do have that use this product swear by it. So you give it, it's a paste, and you use it 3 to 5 days every day until you're breeding or collection, and it will get him going, as they say. So it works really well.
I've used this a couple of times on a couple of different boys. First time dog worked great. I just recommended it to a breeder friend this week. She previously couldn't get her stud dog bred at all, and he has been on it for 5 days and totally interested.
Perfect. That's what I like to hear.
Mm-hmm.
All right. If the Get 'em Going doesn't work, prostaglandins and GnRH can be used to improve libido. Those are both prescription products, so you want to work with your veterinarian on those. Prostaglandins, we have to give it very, very, very tiny little doses because dogs will get nauseous if you give too much, and we don't want them to ever have a negative association with a collection. and the veterinary clinic or the collection. So we want to use those at very tiny doses, very carefully, especially in the brachycephalics, because they can shrink the airways a little bit. GnRH is cisterellin. It is again, a veterinary specific prescription product, and that can be given at home on a weekly basis by injection that will improve his testosterone levels. If you give testosterone or supplements that say they have testosterone in them, you actually run the risk of suppressing his ability to produce his own testosterone. The GnRH stimulates his production of testosterone. So make sure that you're working with a veterinarian that understands the nuances of this. All right. Fresh chilled semen. We have fresh chilled semen. We have frozen semen. Really good ways to be able to utilize stud dogs that are at a distance away from you, or stud dogs that are long since gone because of the number of years that have passed. So if we're going to do a semen collection, you need to talk about collection, the analysis, the extenders, shipping, and then making sure we get the overnight shipping taken care of. When we do a collection to collect the stud dog, you do a collection just like you would for a vaginal AI, but we want to be able to process that semen, spin it down so that you only have the good part, the sperm rich fraction, add your extender, and then you want to ship that in a shipping box. Make sure if you are shipping, what we've started doing is either putting in an air tag or a tile, those little devices that allow you to track the packages. UPS, FedEx, right now, I was told today that they're shut down this week because both of the shipping centers in the US are shut down because of weather. So we have to be using the postal service at this point, but the AirTag will help you to specifically track where the semen is. If you're watching your tracking number on UPS or FedEx, it gives you an estimation. It tells you it went to the shipping center, it left the shipping center. It doesn't tell you precisely where that shipping box is, but an AirTag or a tile in the box will. You can watch it driving up the freeway on your phone if you use that device. The other thing that we're doing this time of year when it's this brutally cold is we're using a thermos. So we're using a stainless steel thermos, and I'll show you a picture of it in a minute, of how to package the semen for these really extreme temperatures. And if you are doing an overnight shipment that needs to deliver on a Saturday, you have to mark the little box with an X that says Saturday delivery. If you ship on Friday, ship it overnight, and you don't mark the box, they'll deliver it Tuesday when you needed it Saturday. So be sure that you're looking at the shipping label, getting a photo of the shipping label, getting an information, knowing exactly what your tracking number is. And air tags are 20 bucks. Throw an air tag in the box, and then you'll be able to really specifically tell where the semen is. If you are shipping in this really extreme cold, then we will use the thermoses. I put a stainless steel thermos with wet cotton balls in the bottom in my refrigerator for 24 hours. And then I take the tube of the semen. I don't put the semen in the cotton balls. That would be bad. You put the tube of semen into the thermos with the wet cotton balls, seal it up, put it in your styrofoam box, and then ship it. And that thermos will keep the semen from freezing in the UPS, FedEx, or the post office truck. Unfortunately, even in this kind of weather, we can have those samples freeze, and frozen semen at the speed of a UPS truck does not arrive live. That semen is dead. The first time I did this was a semen shipment that came from Canada for a Nova Scotia duck-tolling retriever. The first shipment came frozen. The second shipment, she ran to Starbucks. You can go to Starbucks, Walmart, Target, wherever. Buy a stainless steel thermos, refrigerate it, and then you'll have the additional thermal protection of that. These are what the air tags and the tiles look like. So they're easy to buy. They're $20. You can buy them on Amazon. You can buy them at the store. So just have one of those, throw it in the box. If you get it back, great. If you didn't, it was 20 bucks, man. You're spending a lot of money to breed a bitch. $20 is not a big deal. All right, Miranda.
Well, on that note, we have a product here at the Breeders' Cupboard called the Shipmate. A small company out of the US designed it. And it is just a thermos. However, it has a D battery in it. And it keeps your semen from freezing. It keeps it from cooling too fast as well. So that shock freezing or shock killing it by shocking it. And it has a lot of functions that'll let you know what the temperature was as it was traveling. It takes about 4.5 hours to get the semen to about 5 degrees. And then it can, though it can't cool, it will keep it warm enough. So it won't cool it. So you fill it with a box of ice still. You're still shipping it in ice in a or in a insulated box that we sell with it. But it's a really neat little device and it works really well. I've used it and I've had a few customers that won't ship in a box anymore. So something to think about. We also have the two different extenders, the LT and the ST. The main difference is the ST is 5 days and does not have antibiotics, I believe, and the LT does, and it is for 10 days. These need to be shipped cold. They're only stable out of the fridge for 7 days. So when we ship these to you guys, we stick them in with some ice packs and we overnight them to you, and then they go straight in the fridge and they can stay in your fridge as you need them. And as Dr. Greer said, that's a good tip. If you're worried about it, if you think that maybe it's been out of the fridge too long, do a test, stick it in your fridge and see what the semen looks like the next day. We also sell the Mavic AI catheters. So these mimic a tie, contracting the uterus. So it's similar to an AI with feathering. It's just a little bit easier to do, and it avoids your spillback. So when you're doing your fresh chilled shipments, it's something to consider. And then we also have a centrifuge. So if you are shipping your own semen, this is a low speed. So a lot of the ones that spin blood, they'll kill your semen really quick. They start at 4,000 RPM. You can't spin semen at 4,000 RPM. You will kill it. So these ones, you can go as low as, I think, 500. And we were just speaking about it before the webinar, Dr. Greer and I, and she was saying, slower, longer is probably best, but you can go up to 1,500 if need be. And these things are huge. These centrifuges that we sell, they're pretty affordable for the low speed ones, but they are larger. They do take up a fair bit of space. Something to keep in mind.
So if we're doing fresh chilled semen, you have to have great timing. You have to do progesterone testing so that you know when you need to have your semen shipped and when you need to get it. If the semen gets there a day or two ahead of time, go ahead and put it in the bitch. As I have famously said, refrigerators don't get pregnant, but bitches do. So the ideal place for semen to hang out is going to be in your bitch, not in the refrigerator. I have a friend that I was visiting over Thanksgiving. That was the last week of November. And she was shipping semen from Latvia to Seattle. It got delayed. It barely got there. She got it. It was too late to do a surgical breeding in the time of the day that it got there. So they put it in vaginally. She shipped a second sample. It didn't get there because of FedEx. And by the time it finally did, it was all dead. So she only had the first semen shipment that was put in prematurely. She has a breed that typically has 4 puppies at a time. She just had 6 puppies last week. So putting the semen in a little early is much better than leaving it in the fridge where it's not going to stay alive. Your choices with fresh chilled semen to inseminate are going to be a vaginal insemination, which is just put in with a vaginal pipette. And this is a little coton that we have elevated so that we're doing this breeding. Transcervical insemination, which was with an endoscope, or a surgical insemination. Those are the 3 ways you can put in fresh chilled semen. If you're using frozen semen, vaginal insemination is not one of your options. It needs to be done either with transcervical or surgical, putting the semen directly into the uterus. So this is Trish and me about 20 years ago doing a breeding. We still work together. Frozen semen requires even more specific timing. You've got to be precise. The semen with frozen semen only lives 12 to 24 hours in the bitch's reproductive tract, not like fresh chilled, which can live for several days. Again, transcervical insemination, which we do with the endoscope, and this is a picture of me and Bill putting a transcervical insemination catheter into my own personal corgi. You can put it in with a transcervical insemination if you work with a veterinarian that has the equipment. We were just pricing out equipment today, and it's $50,000 to buy new equipment for the scope, the monitor, the whole bit. So not every veterinary clinic is going to have this available to you. But surgical inseminations can be done by any veterinarian that is competent to do a spay. So instead of spaying the bitch, you exteriorize the uterus, make a small incision with the bitch under anesthesia, inseminate directly into the uterus, and you can very successfully get these bitches pregnant. It's obviously more invasive to do a surgical than a transcervical, but if you live in areas that you don't have TCI available to you, surgical insemination is absolutely an acceptable way to breed with frozen semen. So, other questions for that part about breeding? Anything else before we move on, Sarah? You're muted.
Sorry, I thought I clicked it. We have a couple that pertain to this one. Otherwise, we'll go back. A couple about the thermos. Have you ever shipped that thermos up the border? Like
Me?
they're wondering if border would open. Not. I wonder. I don't know if or I don't know if she's talking about the shipmate or with the thermos idea that Dr. Greer had mentioned. Without the border opening it.
I haven't had problems with it, but if they want to open it, as long as they'll repack it, it's fine.
Okay. And then for the cotton balls, you're just dipping them in water to keep them cool.
Yep. Yeah, just wet cotton balls, just with water, put in the thermos. It retains the temperature, so it stays at that cool temperature, but it doesn't allow it to freeze.
Okay. And then the Cana Plus extender, what happens if it's delayed getting to you very cold? I guess you wouldn't know if it's frozen.
If it
Are there,
freezes, the semen will be dead. If it doesn't freeze, it will retain the semen for up to 10 days. So it does a really good job. Temperature is the biggest enemy that we have, both extreme temperatures of heat and extreme temperatures of cold. Those are our biggest enemies during shipment.
okay. This one's a two-part. At what RPM and for how long do you spin semen down?
It depends on how adjustable your centrifuge is. We like to do under 1500 RPMs, and it's going to be between 5 and 10 minutes. What we want to do is push the semen to the bottom of the tube, but not compress it into a tight pellet. If it's too tight a pellet, it's going to damage the sperm. You basically just want the semen to go to the bottom and the prostatic fluid to come to the top, and then you can pipette out the prostatic fluid, leave the semen pellet in the bottom, then add your extender, and then very gently vortex the tube to resuspend the semen. And then when we pack the box, and I kind of went through this slide fast, when we pack the box, if it's a styrofoam box, like Miranda sells, you want to put a frozen ice pack, then a refrigerated but not frozen ice pack, then newspaper, then your tube, and we want it to be horizontal. We want the tube to rock back and forth so that the extender is bathing the semen during the shipment, not sitting upright where the semen all sits in the bottom of the tube and the extender sits on top like salad dressing. We want it to be rocking back and forth, then crumpled newspaper on top, and then you tape your box shut. So this diagram is a cross section of how you want your semen to look in a shipping box. If you're doing the thermos, it's going to be a little bit different, but again, you can put the thermos in horizontally in the box. Now, even when you say there's an arrow on the box, you say this end up or whatever, FedEx, UPS, the Postal Service, they don't read the box, man.
They're,
They throw it in the truck and they drive down the
yeah,
road. So you're kind of stuck
They
with
play
what they
soccer
carry.
yeah,
with it.
they're tossing your box around. The
Well,
second part,
and I actually did this with one of my own dogs. We were kind of messing around one day and I collected him. It was a young corgi, and I collected his semen, put it in an extender, put it in the styrofoam box, threw the box over my shoulder into the back of my van, and then drove around for 10 days in the winter. And 10 days later, I took the box out of my van, took it into the clinic, warmed up the semen, the stuff was still alive. So it is amazing. I mean, I wasn't careful. I did what I thought the UPS driver would do, or when you watch them load the trucks or load the airplanes, they just throw the boxes. That's what your semen's getting done. So pack accordingly.
all right. Next question is suggestion regarding extender brands. My male's post-thaw is extremely low, 10% with mini tube, about 50% with a different product, and according to a third company, about 75 post-thaw, but no report with counts to confirm. Clinic seems to be limited in their product choices.
Buy your own extender. There are many extenders on the market. I typically stick to the canine ones instead of the equine ones. Some are milk-based, some are egg-based, but there's mini tube, there's Symbiotics, there's ICSB, there's Camelot, there's Clone. There's a number of extenders out there. Use the one that works best on your stud dog. The average stud dog should be fine in any extender, but we do have those dogs that are really fussy, and the only extender that'll work is a certain one. So just buy it and take it to your vet. Tell them, I'm sorry, but can you use this? I'm happy to provide it. They'll let you in most cases.
Okay. And then last one for now is what's the best age to freeze a stud dog?
2 to 5 years of age. Once they get over 5, their semen quality starts to decline. Under age 2, a lot of them are just too young to have good semen quality. The smaller dogs, of course, go through puberty a little bit younger than the large breed dogs. But after age 5, we start to see a decline. Now, that doesn't mean every dog has poor semen by the time he's 5, but your odds are better when they're 2 to 5 years old. So these are the books we have. We have the Your Pandemic Puppy, which is a great book to send home with people that are buying puppies from you. Even though it says pandemic on it, it's still a really nice puppy book that goes through all the new stuff about vaccines, spaying and neutering, the ages to spay and neuter, delaying them, not doing those as young dogs, goes through housebreaking behavior, separation anxiety, all this stuff. And then the Canine Reproduction and Neonatology book, which is written for breeders and veterinary staff. And there's a third book that's probably within a year will be published. My weekend plans are to proofread the book. I've just about got it ready to go to the publisher, and the publisher will be Revadana, the same one that published the Pandemic Puppy book. So it should be out hopefully within the next year.
All right. We wanted to take a moment to congratulate the 2025 top 10 dogs of all breed in Canada who were fueled by ProPlan. As you can see from the various breeds, we have formulas that work for all different breeds and sizes. Next slide, please. We have a wide lineup of research-backed formulas to meet health and breed size needs. All of our dry formulas have been feeding trial tested, meeting our high standards for digestibility and palatability. I just wanted to highlight the Sport 3020 line, which is the top fed line for Pro Club breeders. Sport 3020 provides extra nutrition needed by reproducing females in all stages of gestation and lactation. High calorie, nutrient dense formulas. You can feed it as a regular maintenance diet, or you can switch at or prior to breeding and feed through lactation. Feeding trials, not just formulated for all life stages and shown to be highly digestible. The Pro Club loyalty program for breeders offers great benefits and is the #1 choice of Canadian dog breeders. With Platinum Rewards, breeders get rewarded for their Pro Plan recommendations to new pet owners. 3 easy ways to save on Pro Plan. We have bulk delivery for most regions in Canada on volume orders. Easy online rebates. You just snap a picture of your receipt and upload it in your account. We have a 20% in-store discount with PetSmart where you can save instantly at the checkout. And then we have our fabulous puppy kits shown here, which include a free box of Fortiflora for each new puppy owner, a coupon for a free small bag of puppy food, not a sample size, coupons for 3 free cans of ProPlan wet puppy food, and $10 off their next ProPlan bag. Plus, as a breeder, you're going to get 1 free box of Fortiflora for yourself when you order your litter of kits. All of your pet owners can get a kit as long as your account is in good standing for eligibility. We're also offering a free trial for new members. So if you opted in to hear from a ProPlan breeder representative when you sign up for this panel, I'll be following up with you in the next day or so. So look out for that email. If you didn't opt in when you signed up, but you are interested in receiving a free trial offer, please reach out to us and we'll be happy to help get you started. All right, over to Miranda.
So the Breeders Cupboard, we are the exclusive distributor for the Breeders Edge products from Revival Animal Health, as well as their Doc Roy's brand. We have a variety of products from all over the world that are the leaders in their field. If you guys have any questions about any of these products, we have a team of breeders here that are happy to answer all your questions. When you call here, you will get a breeder on the other line, which is pretty helpful. And then we also have a coupon for all of the attendees from the webinar. Save 10 at checkout will save you 10% on your next order. I really
Awesome.
appreciate you guys all attending. It's been fun.
Yeah. Are you good for some questions, Dr. Greer?
There are, and we have 400 articles with including videos and webinars on the Revival Animal Health website. So if you go to the Learning Center, click on the little blue graduation cap, and then put in the search term for whatever you want. Our #1 downloaded video is how to tube feed a puppy, but there are dozens and dozens of webinars and other articles that are really helpful. So please feel free to use that. It's all free to you as a consumer.
Awesome. Yeah, I can't recommend that tube feeding video enough. There's nothing like needing to tube feed a puppy at 2 o'clock in the morning and just needing some reassurance.
I will be there to hold your hand virtually. I took the videos myself. I know that they are correctly done.
Absolutely. All right. So the first question is, any thought on preventing benign prostatic hyperplasia in stud dogs, or is there thought to be a genetic component?
Well, there are probably some breeds that are more likely to develop it than others, but if your dog's over age 5, he's likely to have BPH if he's around females in heat. So there's really not anything you can do to prevent it other than putting him on medication if it's necessary. Now, if he lives a pretty isolated life, no bitches in his life, no bitches next door, no fox out in the field, no wolves somewhere near you, he's probably fine. But if you live in the real world, he's probably going to have BPH. So just plan on treating it. It's not that big a deal.
All right. What can I do about a small male with a large penis? When he becomes aroused or breathes or collects, it's very difficult to get the head of his penis back in.
You might have to talk to your veterinarian about snipping the skin of the prepuce, making it just a little bit wider for an opening. So you would put the dog under anesthesia, make a little incision, suture the edges of the skin back together so the diameter of the opening, instead of being this big, is this big. And then he should be more comfortable. Lubricating it well with KY jelly or some other non-spermicidal jelly can be helpful. If he's a long-haired dog, keeping the hair trimmed off of the end of the prepuce can be helpful as well. If he's a short-haired dog, you're kind of stuck with a lot of gel and maybe talking to your veterinarian about it's a minor surgical procedure. It's not like you open up anything important, but it's a pretty fast little procedure, and most veterinarians are comfortable doing that.
Okay. Is there anything to do other than massaging and cross your fingers to help a testicle descend in a younger male, 6 months?
Carmen Battaglia says, keep your hands off your dog. Don't massage them. Don't mess with them. All you ladies with long fingernails out there, he says, you're just poking around and then making them hold their testicles up tighter. No, be patient. There is an injection series of HCG that I have had decent success with, but not everybody believes that it works. So you can talk to your veterinarian about HCG. It's a prescription product. We try to start that between 10 and 12 weeks of age for the best success. But keeping your hands off the dog is going to be probably the best advice I have is check him once a week. Don't check him every day. All that massaging just makes it worse. Hands off.
All right. The next one, you mentioned tick prevention. What's the safest tick prevention for breeding dogs, and are there any safe during pregnancy?
Brevecto is the only one labeled as an oral. Simparica, Credelio, and NexGard, which I assume you have in Canada, are not labeled in breeding dogs, but Brevecto is, or the topicals that contain the frontline type of products, which is fipronil. Those are the topicals that are approved. Not every product is approved for male and female breeding dogs, and breeding dogs mean it could be an 8-week-old male dog that's going to be your next stud dog. He's a breeding dog. So read the labels. I don't know every product that's available in Canada. There may be some things that I'm not aware of, but read the labels. If you're not sure, read the label, talk to your veterinarian. Veterinarians oftentimes aren't aware that you're breeding or they haven't read the label. So pay attention to what the labels say.
All right. We had two questions about the folic acid. Is it the same dose for all bitches of all sizes, all breeds?
The only published dose is 5 milligrams per dog per day. That is often not practical for the small breed dogs because sometimes it comes as small a dose as 400 micrograms, which would mean 12 capsules to get to 5 milligrams. So if you have a small breed dog, probably 400 to 800 units is enough. If you're a large breed dog, I'd do 5 milligrams. We do have a lot of the revival products like Be Strong that contain higher amounts of folic acid, so you may not need as much in the supplementation. And if you are in a breed, a brachycephalic, that's at increased risk of cleft palates or other midline defects, you want to start that 6 to 8 weeks before she comes into heat.
Okay. So when a stud dog is rarely used, how would you manage a natural tie breeding?
Well, it depends. Does he need some practice to figure it out? If he needs practice, find some easy going female that will allow him to breed. Some dogs just need a little bit of experience to get good at it.
All right. Puppy born with a cleft lip, no history with either parent. Can he be bred as a stud? I'm not sure if that was the puppy or.
I wouldn't
The
breed a dog that
parents.
had a cleft lip. Would I use the stud dog again? I would, but not with the same bitch.
Okay. Got a
And
DNA question.
we did have a question I forgot to ask. So go ahead and ask yours and then I'll come back to mine.
Yep. If a male's DNA shows copies of a variant for the risk of CDDY and IVDD, but the female doesn't, no carrier, should he be bred to a female if she has no copies?
I have a very strong bias about CDDY and intervertebral distal disease. I've bred corgis for 37 years. Every corgi on the planet has 2 copies of CDDY. If they don't, they're a Sheltie, not a corgi. The same with a Basset. If they don't have 2 copies of the CDDY, they're a Beagle. They're not a Basset. So I think that we've gotten a little extreme about how we interpret some of these DNA tests, including this one. So there's no reason not to breed a dog that's clear to a dog that's a carrier. Get over it. In the 37 years I've had corgi litters, I've had exactly one dog go down in the rear from disc disease. That's in 35 litters of corgis. Get over it. You cannot have a perfect genetic dog. So the question that we missed and it was sent to us in advance of the webinar, but I do want to mention it, is can we breed a dog that has a retained testicle? And the answer is that it depends on your personal moral compass. Will he produce puppies with a retained testicle? He will produce a certain percentage of them that have a retained testicle, probably yes. If he is otherwise absolutely fabulous, orthopedically, he passes OFA, hips, elbows, whatever your requirements are. If he has an amazing temperament, if he is structurally beautiful, if he's otherwise perfect, I don't have a problem including a dog with a genetic defect in my breed. There is no genetically perfect dog. Dogs don't die from a retained testicle. They die because they bite people. They die because they have serious orthopedic problems. They die because they have seizures. Those, for me, are the things that I would never include in a breeding program. A retained testicle is not a perfect dog. You can't show him. But in the reality of things, if he is otherwise an outstanding specimen of the breed, otherwise absolutely top notch, let him have a litter, see what he produces. If every boy in the litter has a retained testicle, don't use him again. If you produced normal dogs with normal testicles, use them again. I had a breeding that I did a number of years ago with a corgi. I had one girl, 4 boys in the litter. One of the 4 boys had both his testicles. 3 of them had retained testicles. I repeated the breeding. It was a stunningly beautiful litter. I repeated the breeding. Same dog, same bitch, had boys in the litter. All the boys had their testicles, and they were ugly as sin. The same exact breeding. You don't always get what you think you're going to get. So there's certain things you have to kind of just say, there's no perfect dog. We have to do the best we can as breeders.
All right, so we got some more great questions. 2-year-old male tested low testosterone levels, was recommended to give weekly testosterone injections. Would you suggest week would you suggest switching to weekly cystoreline instead? If so, what dosage?
Yeah, GnRH. The dose is 3.3 mgs per kg once a week as an IM injection. Yes, I would definitely switch to GnRH instead of testosterone because if you give testosterone, you suppress his testosterone. If you give GnRH, you make him stimulate to give his own testosterone. So yes, it's called Cysterellin. It's CYST. It's not Sister Ellen the nun. Sister Ellen. It sounds like that. But she's not a nun. It starts with CYST. It's a bovine product. It's a cattle product, but it can be used in dogs. Off label.
Okay, I have an emailed question. Is there any way to boost a frozen collection on quality? My dog can ship chilled with a thaw of 90% plus. I have him collected for frozen at 2 different repro bets, and his thaw is between 40 to 50%. Semen collections are above 400 million count, but I lose quantity when it's frozen.
Yeah, you probably just need to send twice as much semen as you would if it had a higher post thaw. But there's nothing you can do about the post thaw. If it's 2 different vets and they've done 2 different kinds of extender, he may just be a dog that doesn't freeze well. And there are a lot of dogs that don't. So instead of sending 100 million, you would send 200 million because by the time you account for the loss in the post thaw, that's the best you can do.
Okay,
But
this,
oh, sorry, I
go
was
ahead,
just going to
Miranda.
ask a question there, Dr. Greer. In your experience, when they're thawing low like that, are they less likely to produce a pregnancy if you have the numbers?
If you have the numbers, they should be fine. If you don't have the numbers, it can be a problem. We did a breeding a number of years ago on Thanksgiving. Long story, but we used 38 straws. 38 straws. Average is four, right? But they sent us the bitch, they sent us the semen. They said, you're the only person on the planet that's ever gotten anybody pregnant with this semen. We're sending you everything left on this stud dog. So we went in at 6 o'clock in the morning on the day of the holiday, Thanksgiving Day. I have a lovely technician who was willing to come in. We did the breeding. She thawed 38 straws. We did it surgically. And at Christmas, I said to her, because that was 4 weeks later, I said, have we heard if that female's pregnant? And she's like, haven't heard. Like, that's not good. Waited a few more weeks. We got the litter registration paper in the mail. There were 11 puppies.
Oh,
Did it
wow.
take a lot of sperm? Uh-huh. It took Katie probably 20 minutes to thaw that much semen. But it works. If you can put in enough that you can flood the ovary, you may still get lucky. But you just have to account for the fact that you might need twice as many sperm as you normally would, or 3 or 4 times as many sperm as you normally would, simply because of the low post thaw. So essentially, the dead sperm or the immotile sperm don't do anything, but you just have to flood it with enough live sperm to make it work.
Okay. And with that, I know my own clinic doesn't go over 90, 95%. But somebody's asking, why do we seem to get 80 to 90% males? Is there a way to alter this? Do you give a higher rating?
No,
Okay.
bad luck, man.
All right. All right. Okay, I'm gonna try to go back up to the top. We've got lots of questions. We've got about 9 more minutes. So we're gonna get through as many of these as we can. Would you ever use or throw away a dog that had torsion?
A testicular torsion or a gastric torsion? I'm not sure
Um,
what the question is.
okay. I will. Tammy, if you
Oh,
can let us know
yeah,
if that's
clarify it.
a, if you could clarify that question. We'll go on to the next one. Is it normal for a dog to void his bladder immediately post collection? Not always, but often when he is collected in clinic.
Some do. I've had some that pass out. I've you can have all kinds of things that happen. Yeah, we've got one Jack Russell Terrier that literally faints when he collects. And the owner of the stud dog knew it and she forgot to tell my technician. So the person collected the dog passed out, hit the floor. My
Oh my
technician
gosh.
is freaking out. The client is laughing hysterically. She's like, "Yeah, I forgot to say." So you can get all kinds of weird reactions. That's boys are boys. Can't always predict them.
Tammy has clarified testicular torsion.
He can still be used as a stud dog if you left the other testicle. There's no genetic component that we know of to that. It's just bad luck.
Okay. And would you always do a sperm count on a young new stud or only if there's a breeding issue?
I'd always do a sperm count. I don't see how you can do a complete semen analysis without a sperm count. That's my humble opinion. That's why I think the eye sperm is so valuable.
All right. Okay, you said not to pee your dog before collection, but that you want him to have a full bladder to prevent urine in the sample. Is this the same for a natural breeding?
Yeah, you don't want urine slipping into the ejaculate. So, let him have let him have a chance to urinate an hour or two before you breed him, not 2 days before, like give him a break. But on the way in to do the breeding, that is not when he should be lifting his leg and urinating. Let him come in with a little bit of urine in his bladder. That back pressure prevents retrograde ejaculation. So where the semen goes up into the bladder instead of into the ejaculate, and it prevents urine in the ejaculate. So just don't let him urinate just prior to the time that you're collecting him or breeding him.
Is there a treatment for urethral prolapse?
Surgery, um, to correct the prolapse, and there are some people that will neuter them. But if he's a really important stud dog, you may just do the surgery. It's not a difficult surgery, but it does require a veterinarian that is willing to do a little bit of reading about how to do it and do the procedure correctly. It's just a couple of sutures that you place in the urethra itself to tack the urethral prolapse. I've done them. They're not hard, but not every vet is willing to do everything.
What age in general do you start to worry and watch for semen issues?
After age 5, most dogs until they're 5 have a pretty good quality of semen. But after age 5, we start to see senility changes, BPH, other changes that decline the semen quality.
Okay. Is it just as effective to use all the ejaculate in a fresh insemination without extender?
No, sometimes the ejaculate with the prostatic fluid can be detrimental. So I try to collect only the good part of the semen, the sperm retraction, and then add extender for the volume. I try not to collect extra prostatic fluid.
Okay. The Breeder's Edge product, you mentioned they were reformulated. Does that include the products for bitches as well?
Yes, sure does. Um, Oxymama, Oxymate, Be Strong, they've all been reformulated.
Okay. What are your recommendations for
The
dual
old products,
sired breeding?
all the old products are gone, 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 gone. They're not in stock anymore. You don't have to worry about old product.
Perfect. What are your recommendations for dual sired breeding with frozen semen?
Oh, that's a good one. If you really, really, really want a pregnancy and this is your last bite at the apple, putting in semen from 2 dogs is fine. We've done a lot of them. Sometimes you get sires from both, sometimes you don't, but it is your kind of safety net to make sure that you have the best chance possible of getting a pregnancy when you're questioning the quality of the semen on one stud dog.
All right. Comments on risk of TCI. I'm aware of a case where a bitch died during the TCI. The owner indicated she had perforations in the abdomen.
That would be extremely unusual. We've also had one bitch. We've never lost a bitch to a TCI. Some of them will be a little nauseous afterwards because there's a little bit of gas in the area. I've never lost a bitch to a TCI. I've had one bitch from another clinic that had part of the catheter that broke off in the cervix. Um, I've had a perforation from a natural breeding, a vaginal perforation. That bitch did not die. She ended up in surgery but did not die. I suppose it's possible, but the risks are incredibly small, smaller than a surgical breeding with anesthesia and the possibility of anesthetic complications or surgical complications. TCI is safer than surgical.
Okay. How much extender do you add, or does it depend on the volume of the semen you have?
I typically add 2 to 4 parts of semen for every part of it. I'm sorry, 2 to 4 parts of extender for every 1 part of semen. So if you have 1 cc of semen, you would add 2 to 4 cc's of extender. So that's the ratio I normally use.
Okay. Does timing determine puppy gender? My stud's first and only litter produced 7 males.
I wish I had the answer to that. I have a stud dog right now that I have been using, and he's producing about 80% males. I have a long list of people that want females, and I have 3 boys in my whooping box right now. And this male keeps he gets the bitches pregnant, man, but they're almost all boys. I wish I knew the answer. If I did, I would not be a veterinarian practicing in Wisconsin.
With these new extenders for up to 10 days, would it be possible now to ship fresh chilled over the border safely with good results? Years ago, it was not recommended to ship over the border. We
Yep,
did that
we do.
once.
Yep,
It
we
was
do a lot of.
stuck in Memphis for a while, and it still got the bitch pregnant. It was delayed. She was bred like 5 days post ovulation, but she still took, and the
Yep.
semen was viable.
Yep. Yep, we've shipped from overseas from, like I said, Latvia was our last breeding that we did internationally. Latvia is a lot further away than Canada to the US. So yes, many bitches will still get pregnant with that.
All right, a couple more. We have 2 more minutes to go. Is there a right or wrong way to warm semen up? Can you do it too fast?
I either put the semen in my shirt and warm it up with my body, or I put it in the bitch. Um, you don't want to overheat it. You want to make sure if you're using a water bath that it has a thermometer in it, that you're not overheating over body temperature. But I typically I'll warm up 1 drop, look under the microscope, make sure it looks good, and then I let the bitch warm up the semen, if it's fresh chilled. If it's frozen, obviously you have to thaw it before you put it in, and then we use the water bath with the thermometer and a controlled temperature in that water bath.
All right. The next one is I have frozen semen that was collected more than 25 years ago. How likely is it still to be viable?
Pretty good. Roxanne ran to my lunchroom today and said, "You know that breeding that we did with a 25-year-old semen a month ago?" I said, "Yeah." She's like, she's pregnant with at least five. So most of the time, the semen quality should be just as good as it was the day that it was frozen or within a few percentages. Most dogs will retain the fertility long term. Bovine semen that was frozen in the 1940s, so 80 years ago, is still getting cows pregnant. So frozen well, good quality semen, typically those bitches are still going to get pregnant.
Okay. And then one last question, which is a follow-up on the um, receiving Canna Plus LT. If the vial arrived frozen, it didn't, but curious, would this vial be considered no good?
No,
Or
no,
should it be thrown away, or would you just put it in the fridge and use it in the future?
yeah, freezing the extender without the semen in it shouldn't damage the extender. You should be
Perfect.
fine.
Well, I want to thank you, Dr. Greer and Miranda, and thank everyone for joining us today. It was a very informative webinar as always.
We had great attendance. Thanks everybody for being here.
Yeah.
Thanks, guys, for coming. I learned some things as usual. Thank you, Dr. Greer.
Of course. Thank you guys. Stay warm.
All right. Have a good
Okay.
evening, everyone.